Hello, everyone. My name is Yesenia Zavala. Thank you so much for joining me today. I'll be discussing barriers to mental health services within the Hispanic communities. And this is a very, very important issue because it addresses cultural, economic, and systemic factors that really impact mental health access and the quality of care for this group. So we will go ahead and take a look at my findings and the analysis. So some of the specific challenges that I was able to capture through my analysis was, of course, language barriers within the Hispanic community when seeking mental health services. The cultural stigma, within the Hispanic community, basically leading them to not seek mental health services because they don't want to be stigmatized as being crazy. Financial challenges, being able to afford quality mental health services, especially, as we know, Hispanic communities are low income most of the time. And so we really have to weigh out whether we eat or we get mental health services. So maybe, the financial resources that are available or that are not, is another barrier. Also, the need for culturally competent care. We need providers who can really connect with, the Hispanic community to be able to address the unique needs and experiences of, this specific community. So language is definitely another significant obstacle or barrier for people within the Hispanic community when seeking mental health services. Most of the services are usually in English. And of course, it can be really discouraging for those who primarily speak, Spanish or any other language. Limited availability of bilingual professionals or even interpreters often really means that language becomes a deterrent rather than a bridge to the necessary care that, people are seeking for mental health services. So being mindful of this is really important. So one of the things that we should consider is that in many Hispanic cultures, mental health issues are seen as a sign of weakness. It really leads to, strong stigmas that really discourage people from even seeking mental health services. Who really wants to be considered crazy, or how they say in Spanish, un loco? You definitely would not want to be stigmatized as that. And so this is another reason why, people primarily do not seek mental health services within the Hispanic community. So now we will talk about financial barriers. So economic limitations really impact the Hispanic community. Many Hispanic communities really lack health insurance or access to. Hispanic communities are low income or at low income levels, making mental health services sometimes really feel like it's out of reach, like they're not able to afford it. So additionally, mental health services are associated with, high cost for, therapy, not even including medication. And so a lot of people really have to weigh out the option of either, do I get mental health or do I go and eat, for the day or for the week? Should I spend $150 or should I go buy groceries for my family? So that's a huge dilemma that a lot of people within the Hispanic community face whenever, they are wanting to get mental health services and they don't. Culturally competent providers. This is definitely another barrier for the Hispanic community to be able to access mental health services. And when it comes to cultural competency among providers, we see that way too often where, we go into a medical office and or a mental health provider and they don't speak our language. They don't understand the Hispanic culture, and so in having these mental health professionals not understand and sometimes not even respect the culture, really has the patient feeling disconnected from the provider, sometimes misunderstood, sometimes judged. And that really leads the client or the person who is Hispanic seeking mental health services not really want to go back there. So basically, their needs go unmet. There's also often a shortage of bilingual providers. And in many communities, this is definitely a problem where we don't have, many providers who speak the language of, of Spanish, or we have limited cultural understandings, providers who don't really have an understanding of, their patients' beliefs and values or experiences, or the struggles that, they've gone through, and they're not able to build that trust. Maybe being able to have providers who, are trained with when it comes to cultural humility, that could possibly increase their quality of care for this specific population. Maybe having more community or engagement and partnering with community organizations and leaders to promote mental health services, and that it's okay to ask for help. So yeah, this is definitely another barrier for the Hispanic community, not having, the appropriate representation or, culturally competent providers who can help people with their mental health issues. So now we're going to touch on methodology. So in order to ensure a thorough analysis, I use the PRISMA framework. Well, what is that, right? So this is an approach that really helps to provide a transparent view of studies. And it really ensures that the information that I'm using is actually credible and it's well structured. So I applied the transcultural perspective as well when it comes to methodology, and I really touched on cultural factors that really shape Hispanic communities and their experiences within mental health services. Not only that, but also the Hispanic communities themselves. And in doing this, I really focused on the unique challenges and experiences that they face in accessing and utilizing mental health resources. So yes. So some key findings that I found throughout my analysis of why the Hispanic community or people within the Hispanic communities don't seek mental health services, and they really had to do with language barriers, cultural stigma, financial constraints, and lack of culturally competent providers. And these are the themes that really stood out to me when I was doing my research. Specifically through the Prisma and everything that I was researching. These are the main themes that really stood out. And it's such a shame because what we would want to see is, people seeking mental health services if they need them without having any of these barriers for them to face. But unfortunately, that's definitely not the case from, what the research showed. So some recommendations that I have in order to be able to address some of these issues are that we really do need more bilingual mental health professionals out in the field. We need, to increase cultural competency trainings for these individuals, or providers, I shall say, because, they're the ones providing the service. And of course, to expand financial support, which is, a major factor, of course, in people not, accessing mental health, because again, we got to choose, do we eat or do we go and seek mental health? Do we live or do we, ignore some of our mental health? And then, creating programs that could possibly destigmatize mental health within Hispanic communities are also super important, and if we're able to address some of these, areas, from my perspective and from the research that I captured, we can provide more inclusive and effective mental health support systems. Anyways, to conclude, when it comes to these barriers that Hispanic communities really face in accessing mental health, it is multifaceted. It does involve cultural, financial, and systemic factors. And, we can't, turn the blind eye to that. But, how do we resolve this? My recommendations are really, to expand availability of bilingual services and culturally competent providers, to implement policies and to make mental health more affordable, to conduct community outreach and be out there within the communities, to try to destigmatize mental health, or to develop innovative services and delivery models, make mental health more accessible to families. I know that for me, I find it way more convenient to have my mental health services given from the comfort of my own home through my phone or through my laptop. So, just coming up with innovative ways as well, of providing mental health services. What I wouldn't give for mental health services to be free for all. But unfortunately, then, yeah, that is definitely not going to be the case because we wouldn't have jobs. But yes, that concludes my presentation for today. Thank you so much for spending this evening with me. Thank you so much. Bye-bye.